All right, welcome to our little tutorial. Ashish and I wanted to share with you how economists and behavioral scientists think about the issue of algorithmic fairness. Um, the goal of today's little lecture is to give you a sense of how we think about not just algorithmic bias, but discrimination more broadly. Because in our work, we spend a lot of time thinking about discrimination not just by algorithms, but by people and systems and societies. And so for us, how we think about algorithms is informed by that. Our goal today is not to sort of argue that what we're proposing is the right way, far from it. We clearly need a multidisciplinary approach. And that's really had by different fields learning from each other. I think it can speak for Ashish in saying both of us have learned tremendously from computer scientists, and I've learned in my past from behavioral scientists and how they think about these issues. And there's a lot to be learned. But because economists have worked on these problems for decades, I think economists have valuable lessons from the work they've done that I hope the community finds helpful. All right, so what we're going to do is we're going to go back and forth between Ashish and me. I'll do a little bit on an early foray in algorithms plus people. That'll motivate some theoretical work Ashish has been doing on optimal choice of algorithms by policymakers. Come back to me. I'll talk about two studies in discrimination. Go back to Ashish to talk about regulating algorithms now, and then I'll conclude by looking to the future. Okay, that's the outline for today. Let me start with the early foray. So this is a problem that probably one of the earliest algorithmic problems, putting aside bias, just algorithms applied to human decisions that I worked on. This is work on pretrial. So for those of you who don't know, there are about 12 million arrests in the United States. Right after arrest, a judge has to decide whether someone will wait in jail or go home for trial, or go home and wait for trial at home. At any point in time, there are about 750,000 people in jail. Now, just to calibrate, that's about 1/3 of the entire incarcerated population. That means 1 in 3 people who's incarcerated is simply waiting for trial. They're not guilty. They're just waiting for someone to decide if they are. And they're going to be waiting for a while. It's about 2 to 3 months is the average wait, and in some cases as high as 9 to 12. As a consequence, what this really means is that this decision, will you wait at home for trial, is super consequential for the people involved. Whether they, if they have to go to jail, that's basically it. I mean, it's as if they were convicted for many people. So what we did in this project is that we built an algorithm to solve this problem. We said, what are judges doing? By law, they're predicting flight risk or crime risk. That's what now, that might be a bad thing for them to be doing, but that is what the human is trying to do. So what we did is we predicted exactly that, flight risk / crime risk. We can get into details. You can read about that in the paper. And using historical data, we said, okay, suppose an algorithm were to rank people according to risk, and starting at the left here, release the least risky people. So over here, you release nobody, and you start releasing little by little, you can see the crime rate goes up and up as we release. So that's how the algorithm would perform. This looks different than sort of ROC curves because this is in meaningful units. It's in units of, as we rank people, if we change release rates, how does the crime rate change? So this is the performance of the algorithm. But in economic approaches to problems, we're rarely interested in the performance of an algorithm. We're interested in policy counterfactuals. In this case, we're interested in the question of humans make this decision. If algorithms were to make it, what would change? Would we do better, for example? So we see the algorithm here. We need a benchmark. The benchmark is going to be the current approach, which is the judge. Judges currently are all the way up here. They have a release rate of about 11% and a release rate of about 74% or something. We'll see what that is. And then a crime rate of about 11%. So that's their performance. If we were to make an apples to apples comparison, we could look at this point. You could get the exact same release, same number of people in jail, but get about a 24% reduction in crime from 11.3 to 8.5. But of course, if you are happy with an 11.3% crime rate, you don't need to go down. You could say, let's go across. We could get the same crime rate we have today, but have far fewer people in jail. Not when I say far fewer, I mean 40% fewer people in jail. This was done in New York. The biggest place where people were kept in New York is an island jail called Rikers. A 40% reduction, to put it in units that would make sense, means we could close Rikers in July. That is the magnitude of the effect here with no effect on crime. I want to put a caveat as an aside here and describe some work, some issues here. The graph I just produced for you is a little misleading because there's an econometric issue that's overlooked. We don't have outcome on the jailed. Remember that whenever you hear someone talk about pretrial tools, because we don't know what the jailed people did. How can I tell you how the algorithm will do? I don't have those counterfactuals. And even more important, the jailed may differ on unobservable characteristics. I put unobservable here, which is because economics tends to emphasize the data we have is a tiny fraction of the data available to human decision makers. So the judges are choosing on a lot more than we are. And we see the jailed and say, well, I guess they're probably similar to these people who are similar unobservables. So this poses a problem. We sometimes call it in our work selective labels because we have labels selectively on some people. And the key is that because the judges have private information, purely statistical corrections will likely not solve this problem. These unobservables may interact with algorithmic biases. Ashish and John Roth have some work on this, and there's a few other papers that are doing follow-up work. And so you should not ignore this problem. This is an important aside. In our paper, we deal with this and the results continue to hold, and you should read the paper for details, but I wanted to put this technical aside up front. So assume for now the previous figure is correct. I think to a first approximation it is. So now let's ask, if the algorithm does better than the judge, that's fine from an efficiency point of view, but we care about equity. Presumably the algorithm is racially biased, and if so, how much? Yes, we can reduce jailing, but does that have racial bias? This is probably the first big fork in the road between how social scientists, economists would think about this problem and how people in algorithms have approached it. And here's why. Very often the question now would be, amongst the jailed, what's the racial composition? But you'll remember, I told you, the first order effect here is to reduce the number of people in jail. So if you care about the well-being of the individuals in society and you simply aggregated up their welfare, the fact that I'm not going to go to jail, forget the composition of the jail just for a minute, look at the margin, do I end up in jail, matters a lot. So simply looking at the compositional effect ignores the first order level effect. That is, reducing jailing helps those who would be most likely to be jailed. This is a distinction between outcomes versus process. I use the word versus. What I really mean is there are two things we care about, outcomes and process. We, as I mentioned, we do care about process. I don't want to overlook that, but we also don't want to overlook outcomes. So a focus on outcomes is the key feature of the economic approach. So let's talk about the absolute benefits. If we close Rikers in July, guess who's in jail? Blacks are disproportionately in jail. 57% of people in jail are Black. So simply by closing it or by reducing it by 40%, we help those Blacks the most. The benefits disproportionately fall to Blacks and minorities. 85% of people in jail are minorities, much higher than the base rate in the population. That is, the average person who benefits from this policy is disadvantaged. This is important to keep in mind. There's a disparate benefit of reducing anything negative that affects the disadvantaged. We know this. This is one of the motivations people who are abolitionists who want to abolish jail, because they know jail affects the disadvantaged. In many ways, this is the abolitionist argument. But of course, I don't want to belittle the relative effects. We should also care about those relative effects. Those are process effects. Those are issues of justice. But I emphasize here the also, because it would be as crazy to ignore the relative effects as it would be to ignore the absolute effects. The absolute effects affect people's lives on a material basis, and we shouldn't overlook that. So first point, when you just look at this problem, I think we tend to overlook the absolute effect, and we tend to focus too much on the relative. We should also consider the absolute. But let's look at the relative effect, even in the same algorithm. Of those remaining in jail, what fraction are Black? Well, again, in the economic framework, we're thinking about counterfactual. So what benchmark should we use here? Equal to population? Well, that's a weird benchmark because that's not where we are right now. We have to look at the world as it is. Right now, we have judges making decisions. So if we're asking, does the algorithm make things better or worse, one benchmark we should consider is the judge. So our interest is in policy counterfactuals. The world is as it is. If we were to do blank, replace the judge by the algorithm, what would change on equity and efficiency? So what I'm going to show you here is if we did nothing, this is what the judge produces. Notice the judge is much more likely to detain blacks than Hispanics and minorities than to detain whites. This is a much higher detention rate. You'll remember the detention rate is on the order of about 27% for whites. So now you'll see that the algorithm, in order to reduce crime by 24%, it detains blacks a little bit more, Hispanics a little less, and minorities the same. So if we use the judge as the benchmark, the algorithm is not that much more biased, or is in fact less biased, depending on the group you pick. Of course, we might not be happy with this benchmark because we say, could we do better? We can. If we end up with a world of equal release rates for all groups and ask and give the algorithm and get the algorithm to equalize release rates, we get almost the same gain. Instead of 24%, we get 23%, but now we significantly improve on racial equity. So the two lessons I take away from this are, first, we have to be very clear about the benchmark, and the benchmark can't be an abstract benchmark. We should consider the world as is, in this case, the judge. Second, we can't simply take the algorithm as it was and not give it the objective function that we care about equity. The second row here is just the algorithm we trained without any knowledge of equity. The third row is the algorithm we trained to take into account that we have equity preferences, in this case, want to equalize release rates. So when we've done it correctly, you'll notice we significantly improve on the judge in both equity and efficiency. As you'll see, this is not by chance, and that's what Ashish will talk to you about. So to summarize, we can reduce crime, reduce in absolute numbers the fraction of minority in jail by a lot, reduce in relative numbers as long as we train the algorithm appropriately. And this type of stuff is being rolled out to cities right now, but I want to point out it's not a panacea. The economic approach is always about, oh, there's an intervention, we seem so now the next counterfactual we want to test is, okay, how does a judge using this, what do they produce? Because judges have discretion. We don't know that that situation will be better. So here are the lessons from the economic approach. Focus on outcomes, focus on counterfactuals, not on ideals, and thereby, in this case, recognizing that people discriminate too. Okay, I will hand it over to Ashish, who's going to talk about how to put all of this together into a framework. Assuming he can figure out how to screen share.
Well, so I figured out how to screen share. So now I'm going to take a lot of the ideas that Sendhil provided in the context of pretrial release and try to build out sort of theoretical framework to think about how would a policymaker who's solving a decision problem want to use an algorithm in their choices. And so in order to establish what the economic approach to this problem is, I think it's useful to sketch from a 30,000-foot view how computer scientists have typically thought of this problem. And in particular, the computer science community typically starts by noting that what a supervised machine learning algorithm does is it produces a prediction function, call it f hat, and that's just going to be a mapping from some observable features w into an outcome or label y star. And since that's just a mapping from features to outcomes, we can define what it means for such mappings to be fair. And then the literature will take these definitions of fairness as the primitive and use that in training procedures. So what this means at the end of the day is that the problem of constructing fair decision rules or fair supervised machine learning algorithms boils down to adding a fairness constraint into our training procedures. Rather than simply trying to find a loss minimizing algorithm, we're going to try to find the loss minimizing model subject to the constraint that it is fair. Now, in contrast, the way an economist or the economics community would set up this problem is to try to embed concerns about algorithmic bias into what we would call the social welfare function, which is a function that's going to summarize society's objectives over the outcomes that are going to be generated by decisions. And it's going to capture the fact that society in these settings has preferences over both efficiency, maximizing outcomes in some sense, and equity, some sense of the distribution of outcomes across groups. And in particular, in this framework, explicit equity preferences are going to arise through the definition of the social welfare function. And those equity preferences are what is going to drive concerns about algorithmic bias. And so what I'm going to do in this framework is going to begin with the social welfare function and then derive its implications for the construction of algorithms in a prediction problem. And so in particular, this problem is what economists would call a first best problem, in which the social planner or policymaker has full control herself over the design and use of the algorithmic decision rule. And this is going to draw parallels between research and algorithmic fairness and a lot of work in economics and statistics on statistical decision theory. So with that in mind, let me sort of summarize what's the context and framework we're thinking about. So we're thinking about policy problems or decisions that we're going to call screening decisions, in which individuals in a population have to be screened into a program based on a prediction of some unknown outcome of interest, Y star. And this is going to cover important applications such as pretrial release, like Sendhil just talked about, but also settings such as hiring, credit approvals, and others. Individuals in the population are going to be described by some characteristics called capital W, and an additional group membership that's going to be binary. And we'll let G equals 1 for the protected group. And so that's the group we have equity preferences over. And then as a last bit of notation that will appear later on, we're going to define this theta star of little g and w to be the conditional expectation of the outcome of interest given these observable characteristics. And so the problem we face in a screening decision is we want to predict the outcome of interest given these observed features and then admit individuals into the program based on these predictions. In pretrial release, we want to predict pretrial misconduct risk or flight risk given observable features, and then decide which defendants to release or detain based on those predictions. And so the question we're going to focus on is what algorithm would the social planner or policymaker choose to solve this problem? So we'll suppose that a social planner or policymaker wants to construct an algorithm and select an admissions rule in this screening decision. And we want to understand what algorithm would she construct and what admissions rule would she use given available data. So in order to figure out what the social planner would do, we have to specify what are they trying to optimize? What's their goal in this setting? And we're going to say the goal for the social planner is a social welfare function, which is simply a weighted average of the expected outcome of interest among individuals that are admitted. So this little t of GW says what fraction of individuals with characteristics little g and little w are admitted into the program. Theta star is the average outcome of interest associated with that group. And last and most importantly, this psi sub g is what economists would call a social welfare weight, which is going to describe how does the social planner value outcomes differently across different groups. And these social welfare weights are going to summarize the social planner's preferences for efficiency and equity. The social planner cares about efficiency in the sense that social welfare is larger if she is able to admit individuals that have a higher average outcome. And the social planner is going to care about equity to the extent to which these social welfare weights vary across groups. She's going to value outcomes associated with the protected group more if the social welfare weight associated with the predicted group, psi sub 1, is strictly larger than the welfare weight associated with the rest of the population. And lastly, I want to point out that while this is an economic perspective on the problem, recent work in computer science has been drawing a lot of insights from this. For example, taking this fair classification problem and asking what are the implied social welfare weights across different groups. And this is some recent really interesting work in that space. And so the problem that the social planner has is she does not know the true conditional expectation of the outcome given observables, and she wants to pick an admissions rule in order to maximize the social welfare function. And lastly, let me tell you what information the social planner has in solving this problem. And the information is going to look like a standard supervised machine learning setup. So the social planner is going to receive access to some training data set that's going to consist of n random draws from the population of interest. The training data set is going to record the group membership of each individual, the characteristics W of each individual, and additionally a measured outcome that we'll call Y tilde. And we introduced this to try to model the fact that sometimes in training data, we don't actually have access to the outcome we care about. Instead, we have some information that we were able to record in the context. And so what this means is that this training data set is useful to the social planner insofar that the measured outcome is informative about the outcome of interest, that y tilde is related to y star. And the social planner has a sense of what that mapping may be through her prior beliefs, which we're going to denote by pi. So with all of that set up in mind, we can now define what exactly is the social planner trying to do here. And again, this looks very similar to a supervised machine learning setup, where we're just modifying what is the objective function. So the social planner wants to pick an admissions rule, a screening rule, this little t, that's going to depend on the data. And she wants to choose that rule to maximize average outcomes, where outcomes are going to be defined through the lens of this social welfare function. And she cannot admit everyone into the program. And so she faces some capacity constraint, which is going to say she can only admit fraction C into the population. So now, what does the social planner's solution to this problem look like? What does the optimal algorithm chosen by the planner look like? And in particular, it's going to have two key components. So it can be decomposed into two parts. The first part is going to consist of a prediction function, which will take in the training data and convert it into predictions of the outcome of interest. And second, an admissions rule, which will take in the prediction function and convert that into decisions. So first, let's look at what the optimal prediction function looks like. The optimal prediction function is going to simply be what is the social planner's conditional expectation of the outcome of interest given the observables under her posterior beliefs. After she has observed the data, she updates her prior on the relationship between the true outcome and the measured outcome, and then makes decisions according to those beliefs. And in particular, what we see immediately is several things. First, she uses all available information in the training data and her prior beliefs to construct this rank ordering of the population. She's not throwing away any information in the problem. Additionally, and most importantly, these social welfare weights, or the planner's equity preferences, are not entering into the choice of the prediction function. In other words, if the planner had no equity preferences, social welfare weights were constant across groups, or she had an explicit equity preference, a larger social welfare weight associated with the disadvantaged group, she would pick the same prediction function no matter what. And lastly, what we talk about in the paper is that we can interpret this prediction function in a very natural way. She's going to use the training data to first construct predictions of the outcome of interest, and then use her prior beliefs to map those predictions of the measured outcome into predictions of the outcome of interest. Again, at no point in this mapping are her social welfare weights or equity preferences entering into the optimal algorithm yet. So where do equity preferences enter? Equity preferences enter into the choice of the admissions rule. In particular, the social planner's optimal admissions rule is a threshold rule with group-specific admissions thresholds. She takes her prediction function and compares it to a threshold that may vary across groups, and this threshold is going to depend on the social welfare weights. If the planner has an equity preference, she will choose different thresholds across groups. If she has no equity preferences, she will set the same threshold across the whole population. And so the key idea is that the social planner's equity preferences are only modifying the admissions rule. They're not modifying the choice of the prediction function. And in particular, they're only modifying the admissions rule in a very specific way. It's generating group-specific admissions thresholds, and those thresholds are going to depend on the social welfare weights. And so zooming out, what's the punchline of this analysis? The punchline is that in trying to solve this screening problem, the social planner, the policymaker's goal, is simply to generate the best estimates of the conditional expectation of the outcome given the observables. She does not want to blind the algorithm to group membership. She does not want to remove any characteristics from this prediction problem. And she doesn't place any additional constraints in the training procedure of a prediction function. Equity preferences are only modifying the admissions rule, not the prediction function. And that really sort of provides sort of a theoretical framework for thinking about those results in pretrial release that Sendo was talking about at the end there. And lastly, I want to note that this insight that the optimal decision rule looks like a threshold rule with group-specific thresholds has been pointed out in the computer science literature before. So some recent papers show that if you wanted to solve a fair classification task with a particular choice of a fairness definition, the optimal solution looks like a threshold classifier with group-specific thresholds. And what we think of is as the economic value, the value of the economic perspective here, is that the social welfare function approach highlights the generality of this insight. It's not specific to particular choices of the fairness definition. We see that the optimal algorithm in any setting where the social welfare function takes this form is going to be a threshold rule with group-specific thresholds, and the social planner wants to use all information in forming predictions. So with that, I'll pass it back to Sendhil.
There we go. Yeah, thanks, Ashish. That's great. And just to underline what Ashish said, you'll notice that one reason that the algorithm did better than the judge in pretrial is in part because we set different thresholds to equalize discrimination across groups. But why did it do better than the judge? It did better than the judge because people forget this in the algorithmic bias literature sometimes, which is that humans are biased as well. And when we produce an algorithm like this that extracts optimally the information and then equalize thresholds, we are more efficient than the human who's not extracting all the information, and are less biased than the human because we're setting equal thresholds across groups. And so as a result, it's almost generically the case that when you're dealing with human decision makers, you should expect to do better on efficiency and equity than the human decision maker. Okay, so now we're going to move from that to a slight change, which is so far we've talked about policymakers choosing their own algorithm. Oh, we as society are trying to figure out, would an algorithm aid the judge in making this decision making? But in the world, most choices are not made by the policymaker with their preferences. They're made by people who themselves might be discriminatory. And those are the people picking and designing algorithms. So how does a world look like when people are making the choices? So I want to talk about two studies here that will illustrate the key points I want to make. The first study goes back to the labor market. Ashish touched on hiring. Let's talk about hiring. These are unemployment rates over time for Blacks and whites and overall. And you'll see there's a big gap in the US in Black-white wage gap and unemployment. There's also big Black-white wage gap differences. So we know that there's a disadvantage here. We know the Blacks are doing worse. But who is to blame? Are employers discriminating? This type of question is at the heart of what economists spend a lot of time on, which is we can see there's a disparity, but where in the chain does the disparity become a big problem? Who's responsible? This could be indicative of employers taking two similar looking candidates and favoring the white over the Black. It could also be indicative of a biased school system that does very badly at training Blacks. It could be informative of many things in the pipeline. Together, we see this result. So how would we go about figuring out if employers are discriminating? Now we're talking about people, not algorithms. So one of the early things we did was to try something like this, where we took resumes and we sent out the same resume, or actually 1,000 variants of different resumes. But before sending them out, we randomized. Some of them got a very white name and some of them got a very Black name, a distinctively Black name. Ones where people looking at these resumes would say, oh, I think this must be a Black candidate. Now you notice, because everything is balanced and randomized, what you get is you get a very clean measure of, in this stage of the process, how much discrimination is there. It isn't about how much discrimination there is in totality. It's how much discrimination is there at a lower bound. It doesn't tell us all of the discrimination, just gives us at least a lower bound on how much there is. And what you tend to find is, even this lower bound, there is a lot. Brendan gets called back 50% more than Jamal, which is interesting because if you look at the unemployment graph, that was actually about 50% higher. So that's the first study. Let me tell you about the second study. It's about a set of programs called care coordination programs. These programs are interesting because what they do is that they target patients who have a lot of chronic conditions, and they want to give them extra resources because you're going to be in the hospital a lot. But to do that, they have to decide who gets into this program, because not everyone can get these extra resources. So a lot of hospitals around the US use an algorithm. About over 100 million patients are affected. The one we study in particular, roughly about 80 million patients are impacted, but this category of algorithm applies to easily in the high 100 million. And what do we do? Well, what we do is we take this algorithm and we ask, is it racially biased? Well, again, there's a lot of disparities in the health system, just as in the labor market. Here, I want to pinpoint, is this algorithm biased? Well, this is a very straightforward exercise because we have access to the algorithm. So what do we do? On the x-axis, I'm going to show you, this is the algorithm's ranking. On the y-axis, we have a huge set of patients. And for each patient, I'm going to show you how sick they are. That's the Gagne score, that's the y-axis. And I'm going to do this for Black patients and white patients. You'll notice what's striking here, conditional on risk. Blacks are always sicker than whites, about 28% more chronic illnesses at this threshold. Now, this is the threshold at which people are auto-enrolled. That means if we zoom in to this area, the marginal person being left out, who's Black, is much sicker than the marginal person who's making it in, who's white. Were we to try to equalize those thresholds, picture it like removing these less sick whites in favor of these sicker Blacks, we would end up drawing a line horizontally and admitting that way so that we have same health at the margin. Doing that exercise would double the fraction of Blacks auto-enrolled. So it's a huge racial disparity in the algorithm. So we had two studies, the audit study and the health algorithm study. And it's going to be, one is about the racial bias of employers, the other is about the racial bias of an algorithm. Comparing and contrasting these two experiences proves instructive for what Ashish is going to discuss next, which is how do we manage bias in the market? So let's compare and contrast. Let's start with the first thing, uncovering bias. The audit study required a tremendous amount of cleverness and complications to even get to this point. It's like a clandestine spy operation. We have to make up fake resumes, send them out, have phone calls. This is at a time with faxes, because we don't actually know how employers are choosing. We have no idea. So we have to kind of run them through fake candidates that are otherwise equal. We know how the algorithm is choosing. It's the algorithm, it's right there. It's a straightforward statistical exercise. Producing that figure, once we have the algorithm, is very straightforward. But the key here is we have to be given access to the algorithm. It would be even easier if we had access to the training data. But given those two things, it's actually just a statistical exercise. People overlook this, which is uncovering bias in humans is an extraordinarily complicated activity because it's hard to take the same person and run them through counterfactuals. People don't work that way. We can't run people through counterfactuals. We can run algorithms through counterfactuals relatively easily. What about understanding why the bias happened in the first place? Here, for humans, we don't know. This is still ongoing research 20 years after that original study, because human and organizational processes are messy. It's easy to say, oh, because people are biased. Which people? Was it the resume screener? Were people intentionally biased? Does this show, sort of prejudice? Is it implicit bias? They're doing it without realizing it. If they're doing it without realizing it, what's going on? Hard to tell. With the health algorithm, we can dissect it because we have the algorithm. We can figure out what's going wrong. One clue is in what's going right. If I redid that same exercise, but I put dollars, not sickness on the y-axis, the racial gap disappears. The algorithm is well calibrated by race for total health costs. So what's going wrong? The algorithm is predicting costs, not health. Whites have better access to healthcare. Blacks utilize less healthcare and cost less. At every level of health, at every level of sickness, Blacks just use less healthcare. As a result, accurate cost prediction means biased health predictions. I want to pause on that to realize this whole error came because of the objective function given the algorithm. It is being asked to predict costs because that is data we have readily available. And yes, and as a result, it's biased health prediction. That's a diagnosable thing. So while it's hard to know why what humans are doing, again, dissecting bias is a straightforward statistical exercise. Again, given access to the algorithm, I'm going to keep emphasizing that. If we didn't have access to the algorithm, there'd be no difference here. Let's talk about fixing the bias. What does it look like on the left? Well, this is a huge set of audit studies extended out to 2015 of the type I showed you, and you'll notice nothing's changed. There was a very recent study by some researchers at Berkeley, which was huge in sample size, and they found exactly what we found, 18 years later. nothing has changed. So I think it's fair to say little change. And why? Human and organizational processes are messy. We're even just trying to figure out what it is we're supposed to fix. What happened with the algorithmic bias? Well, what happened was we were able to modify the algorithm and develop a fix. We're able to get the same benefits, eliminate the inequalities with almost no effect on net cost. And numerous health systems and manufacturers have reached out to implement the changes now, and we're working with them. In fact, it's not just us, regulators and Congress has started probing the original manufacturers. It's fair to say we're on a path. We're not there yet, but we're on a path where people are trying to, we have fixes and we're trying to upload the fixes. So for fixing the bias, I by no means mean to imply we fixed it at all, but we are on a track as a society to be fixing at least that particular bias because we uncovered it, dissected it, have it fixed. It's now a technocratic matter. It depends on political and policy will, as many things do in society, but we at least see the path forward. So you see the big difference. Human bias is intransigent, hard to find, hard to dissect, hard to uncover, hard to understand what's causing it, and hard to fix. I want that perspective in your minds because for those of you who worked on algorithmic bias but not really worked on human bias, I think it's easy to get a one-sided image. These are all very hard for algorithms, but they are orders of magnitude harder when humans are involved. So as we think to regulating algorithms, what we want to do is we need to think about the challenges in uncovering discrimination, the asymmetry of information here. We don't know what employers are doing. That's why we had to run an audit study. The focus on humans as well as algorithms, as I've emphasized before, having the counterfactual, and again, focusing on the fairness properties of the outcomes, not of just rules and algorithms. So that's going to be the economic approach to this problem, which I'll let Ashish take away.
Yeah, so what I'm going to try to do is try to develop a sort of modeling framework for thinking about these ideas that Sendhil just introduced, how difficult it is to regulate discrimination when human decision makers are involved, and point to or suggest that things may be a little easier when algorithmic decisions are the object of interest. And so as Sendhil pointed out, in this setting, oftentimes the problem the policymaker faces is not, I get to choose the algorithm and then implement it. It's they have to regulate a third party firms or decision makers. And in this setup, we're going to be drawing on ideas from economics that come from literature on contracting and literature on mechanism design. And I think going forward, this is a very exciting area for economists and computer scientists to collaborate together. So to build this framework, we're going to think about a model in which a social planner or policymaker now oversees a market of human decision makers. And each human or firm is going to face their own screening decision like we modeled before. The social planner gets to observe the resulting admissions rule, who does the human admit into the program versus not, but does not get to see the human's prediction function. Sort of the human mind is a black box. And what this generates is two constraints for the policymaker in this regulation problem. First, the policymaker is going to face a policy constraint. She can only enforce regulations on the human's admissions rules, what W's can affect who can enter into the program. And it generates an information constraint. It means that when the social planner observes the decision maker admit one person but not another, she can't tell if that was because of differences in the observable characteristics W. Perhaps W has signal for predicting Y, and this is just the human trying to make good predictions. Or is it the human that is discriminating? Are they using these observable characteristics to try to screen out members of the disadvantaged group? And in setting up this model, we're going to show that it captures a lot of the existing intuitions about the difficulty of regulating discrimination in human decision makers. Regulating discrimination involves disparate treatment and disparate impact tests. And in equilibrium, discrimination is positive in the market. Minorities are discriminated against. And then we'll analyze how algorithmic decision-making fundamentally changes this problem. And so I'm going to just sort of quickly go through the modeling framework because the ideas and sort of tools are going to look very similar to the first best problem. So we're going to build out the screening decision that's faced by these human decision makers. Again, humans have some preferences that are going to be summarized by weights on outcomes across groups. And what they want to maximize is a weighted average of the outcome associated with the admitted group into the program. And humans come in two types. Some are non-discriminatory. They place equal weight on outcomes across groups, and others are discriminatory. They explicitly place less weight on outcomes associated with the minority group. And if you talk to economists in this sense, these human discriminators are taste-based discriminators. Humans also have some information when they're making these screening decisions. And in particular, we're going to model them as having some prior beliefs on how the characteristics affect the outcome of interest. And in particular, humans are also going to differ amongst each other in thinking about how complex is the relationship between the outcome of interest and Y star. Some humans are only going to believe that some subset of the characteristics are relevant in predicting the outcome of interest, and we'll model that through what we call a model M. And then finally, each human faces a capacity constraint, just like the social planner faced in the first best problem. And what does this all mean? It means that in the status quo, human decision makers make choices in a manner that look very similar to the structure of the social planner solution. Their optimal algorithm consists of two components. First, a prediction function, where now this prediction function comes from their prior beliefs, their mental black box. And they use that prediction function in an admissions rule, where that admissions rule is going to be a threshold rule with group-specific admissions. And in particular, if the human decision maker is discriminatory, that threshold rule is going to discriminate against the minority group in this problem. And so the challenge of the social planner is that she gets to observe the final admissions rule, but she does not get to observe the implicit prediction function used by the human decision maker. And so then what's the social planner's problem? The social planner wants to maximize outcomes across all screening problems of all human decision makers, and will assume that the social planner now is aligned with the non-discriminators. She just wants no discrimination to exist in the market. So then how can the social planner affect humans in this problem? She can affect humans through what we'll be calling model regulations. She can place rules on what characteristics can be used in admissions decisions. So for example, she may ban humans from making different admissions rules across groups, like a disparate treatment test. And in particular, this is going to be a valuable policy tool because banning characteristics from being used in admissions rule has an effect. It forces humans to change the way they rank order and make admissions decisions by pooling decisions across groups. And the idea is, can they use these model regulations to make humans choose in a manner that is similar to what the social planner would like them to choose? And so finally, the social planner's regulation problem is going to be to pick these model regulations for the market to maximize aggregate social welfare. And so the social planner is going to search over model controls to find regulations that induce human decision makers to make choices that are most closely aligned with the social welfare function. And so the key idea that comes out of solving this problem formally is the following, is that the social planner faces what we're going to call a flexibility trade-off in this regulation problem. The idea boils down to the fact that non-discriminators will only use characteristics in their admissions rule if they are predictive of the outcome of interest. In contrast, discriminators may additionally wish to use characteristics in their admissions rule in order to discriminate against the disadvantaged group. And so this flexibility trade-off comes from the fact that the social planner or the policymaker cannot see into the human's black box prediction function. Letting humans use more characteristics can have two effects. It could let non-discriminators better predict, but it could let discriminators better screen out members of the disadvantaged or the minority group. And therefore we show optimal model regulations or optimal regulation of human discriminators takes the form of disparate impact tests. Does a particular variable have sufficient predictive power for the outcome of interest relative to its predictive power of group membership? So I very quickly sketched out what the problem looks like when the social planner is regulating humans. How does the introduction of algorithmic decision-making change this problem? And so we're going to think of the introduction of algorithmic decision-making in the following way. Human decision makers commit to using an algorithm that's going to take the form of first, a prediction function for the outcome of interest, and then they're going to make screening or admissions decisions based on that prediction. And we're going to model the introduction of algorithms in sort of a very simple way. They reveal ground truth, the true conditional expectation function of the outcome of interest given the observables to the human. And the human cannot manipulate this, and that's sort of an important assumption in the model. And so the question is, given ground truth, how would the social planner regulate the human's choice of prediction function? So given this theta star, how would the social planner regulate the human's prediction function that she uses as input? And as Sendel pointed out in the healthcare application, the key idea is going to come down to whether the social planner has access to what we call an algorithmic audit, which boils down to the social planner having access to all underlying training data, underlying training procedures that were used to construct the prediction function. And in the model, algorithmic audits are going to reveal ground truth to the decision, to the policymaker. And the key is that this is going to eliminate one source of private information between the policymaker and the human decision makers. And so now the social planner can condition her model regulations on the ground truth, on what characteristics are actually predictive of the outcome of interest. And so the main idea that comes out of this model is the following result, which is that if the social planner has access to these algorithmic audits, the social planner now finds it optimal to allow human decision makers to use any characteristics that are predictive of the outcome of interest in forming their predictions. And the reason is that since the social planner, through these algorithmic audits, knows what ground truth is, she can understand why a characteristic is included in the admissions rule. If a characteristic is used in an admissions rule, but not predictive of the outcome of interest, then it must have been included in order to screen out the disadvantaged group. It must be there to discriminate against the minorities. And so what we see is that the presence of algorithmic audits yields another form of irrelevance, equity irrelevance in the context of prediction. But crucially, this result is going to rely on the presence of robust algorithmic audits. Does the policymaker have access to underlying ground truth through the form of the prediction function and the underlying training data? And so this framework tries to formalize some of the ideas that Sendel was sketching out in comparing resume audit studies with this healthcare audit study that he also conducted.
Thanks, Shesh. I will now close us off. Let me just, there we go. To underline and close us off, I think one of the things I want to emphasize is you'll see how by looking at all of the forces involved, what do people do? What are the policy counterfactuals? You get a much richer and different look on the problem than by looking at the algorithm alone. I don't want to imply that the results that Ashesh and I have shown you are somehow like ironclad truths, but it is revealing that very straightforward models set up at this level give us very counterintuitive predictions, such as we should not bar the use of protected variables, et cetera. That tells us that by looking at the bigger picture, we may end up with very different conclusions, and I hope this is an invitation for all of you to do that. Let me conclude this by sort of looking into the future. First thing I think would be really, really helpful is a more integrated approach. And everything we've shown you, I hope you've seen this way of thinking has much to offer, but I think it needs to be integrated with other ways. One of the things that I think it needs to be integrated most with is why should we take certain parts of the system as given? We did that in pretrial. We did that in employment and hiring. This is kind of an Achilles heel of economics in that we take most of the world as given and we focus on one narrow counterfactual. But for example, why should the current judicial system be the one we focus on? Even something as simple, research has shown, as changing the structure of how people told about their bail dates can have differences on who fails to appear. So understanding how we might make other changes in parallel with algorithmic regulation and having frameworks for that would be very helpful. In the interest of time, I will summarize this other paper that I want to conclude on and just walk you through it, which is, I think there's room for doing good as well as preventing harm. To me, that's the most exciting direction as we look into the future. Everything Ashesh and I have told you about today is about preventing harm by discriminators, by potential adoption of algorithms when we shouldn't, by judges. But I think we can do good as well. We can actually go forward, and algorithms can be powerful for that. This work by Emma Pearson, which was in Nature Medicine this year, shows how algorithms can actually find signal about why patients were complaining about pain in their knee, and find signal that humans had missed. And importantly, signals that were missed that were disproportionately affecting Blacks and disadvantaged. To put it simply, Black people and disadvantaged people were in more pain than appeared to make sense to clinicians given when they looked at their knees. When the algorithm looked at their needs, it said, oh, look what I found, something you've missed that was happening in these disadvantaged people's needs. So that shows us how algorithms can expand our aperture and really go forward in solving more fundamental problems. Okay, I'll stop there and thank you, everyone.
Thank you, Sandal, for such an interesting talk. So there's a good amount of questions. Shall I start?
Sure. Let's get started. Why don't you use your prerogative to pick whatever you like, or what you think would be fun for us to talk about.
So I'll probably start with the order in which they came. So first question is by Kristen. So were you really predicting flight risk and not just FTA? If so, how did you measure the flight? It is from the starting part of the presentation.
Yeah. And it's a great question. I think a lot of these things come down to the exact notion of variable definition. And so the distinction I think the question asker is asking is really important. Failure to appear, lots of people have failures to appear for technical reasons, and then they showed up later. And so part of what we did there, and it doesn't mean it's a full solution to the problem, is that you want to identify using the longitudinal data, not just the data you have on hand, whether the person not only failed to appear, but never actually appeared in court again for a sizable period, and was actually had an arrest warrant put out for them because of this. And so that's how we ended up calculating it. It's not perfect. There are still issues, and one has to be careful about those issues. So yeah.
Okay. So next question is by Suresh. Is asking like why are the relative effects are viewed as process effects?
Why are the relative effects viewed as process effects? Yeah. I think the way I kind of think about it is that you kind of have to decide what is the counterfactual that you are implementing. And if you focus just within the algorithm, then that is the process issues are about how X gets converted to Y inside the algorithm. The relative effects are the counterfactuals about if you implement this algorithm versus something else. And if you're doing this versus something else, then all of these absolute effects matter a lot because it's this versus this. How are people made better off? The relative effects are process effects in the sense that they're about what's going on inside the algorithm. They're not simply just about what happens here versus what would happen if you did something else. I think that's the sense in which I meant relative effects typically tend to be process effects.
Okay. And one of the popular and upvoted question is how do we determine the social welfare weights and who is responsible for that? And this is I also have this question.
It's a great question. I think this is one of those situations where partly there's a disciplinary issue, and partly there's just something that we as scholars have to think about. So let me tell you the disciplinary issue, which is, I think that in a discipline like economics, correctly or incorrectly, the presumption is, look, we are technocrats. It's not our job to figure out policy weights. It's the job of whoever or whatever group of people is in charge, the elected leaders, and there's a political process, there's a democracy. Some people end up, representing the people, and it's those policymakers' decisions about what the weights are. And so economic models have that property. They are not, here's the policy suggestion. They are input policy preferences, output policy suggestion. And so they have that big input level. Now, in practice, of course, economists are people. They tend to impose their preferences into things. So that's clearly happens without question. And there's another problem that I think people in the humanities would accuse here is to say, look, there is no neutral activity. You think you're being technocrats, but you're imposing things. So there's a complex area. But as a mathematical fact, the way these models are just written is here is the way somebody is supposed to determine them. Now, why I think that's actually, it's not meant to be the neutral position that it's conveyed, I think, but why I think that's very helpful is it decomposes two activities for us. The activity of given preference, what is the right solution, versus the activity of what should our preferences be. And the activity of what should our preferences be is amongst the most important social conversation we can have. It's like the ethical conversation, it's the persuasive conversation, it's what we try to do. But it also doesn't need to be conflated with this more technocratic thing of, okay, once I fix preferences, what follows from that? So I think the decomposition, at least in principle, can be super clarifying. And there are lots of reasons to mingle these together and so on. But does that answer your question, Sandhya? It's like it as an academic, it helps force you.
Yeah, it does. And plus, then there'll be another angle to it. Again, if it goes to the social makers, that there'll be human bias coming up there.
And that's exactly, and that's one of the things that's important to keep in mind is that sometimes when you work in this area, partly what you're fighting against is the preferences of policymakers. When you find yourself in that position, that's a different kind of work that you're doing. It's about persuasion, it's about argumentation, it's very different, it's very important, but it's different. That's different from when you are in the position of saying, policymakers want to accomplish this goal. To accomplish that, here's what we now need to do. So I think that's why this distinction is super helpful is, look, if you really believe you're fighting policymaker biases, which sometimes you are, I mean, you're going to have to now convince people. That's persuasion is a different activity and an important one.
Yeah, sure. So the other question was by Monica. She's asking, is the detention rate and release rule too myopic in the discussion of equity? Can we include other social factors to determine recidivism rates? And then there's a continuation to also this question. And how are the admission rules reviewed and adjusted by the judicial body?
Yeah, so the release rate, I actually think is not too myopic. And to put it in perspective, the reason I don't think that's too myopic is because jailing someone is a brutal activity. And every time we do not do that, that is a very good activity. And every time we do it, it is a terrible activity. So that variable, I think, is very clear cut. And to me, that's like, we should really fixate on that part. What's on the y-axis, the crime rate? Absolutely. I mean, even like, should all crimes be counted similarly? Should different crimes? I mean, there's so much other things we could talk about there. I mean, what's property crime? It's just a redistribution. So there's lots of issues at stake there that ought to be refactored and refactorized. And that is exactly what that's what the policy discussion should be. It's like, what should we care about? And I think that couldn't agree more. And the judiciary, I think there's two things to keep in mind. The judiciary is obviously not just active, they are the final arbiter of all of this. But they sit under something else. They sit under the actual law. The law is very clear. Now, that doesn't mean it shouldn't be changed, but as it is, it's very clear. It says the focus on flight risk or flight and public safety risk is the only thing the judge should focus on. That's not, again, I don't mean to imply that's what things should be, but it is worth knowing that is the way things are.
Okay. The next question is by Suresh. She's asking, how would you recommend model regulators address the dynamic and shifting nature of which features correlate with which outputs and how the disparate impact effects might change it.
It's a great point. I guess that should probably be our last question. We'll end on Suresh's question.
Yeah.
I think the shifting dynamics, I don't think are by themselves that problematic, and I'll explain why. Ultimately, the regulator's job is to assess whether the algorithm deployed at time t, has problems, and that was trained on data at time t-1. That's a dynamic process, and regulators are very comfortable with regulating in continuity. That's how regulation works in every other sector. So the idea that people keep changing their algorithms in response to changing conditions is not that complicated. The challenge is if the dynamics creates an equilibrium. So in other words, if the algorithm changes the behavior of people, which then changes the context, that becomes significantly harder. So a historical example people used for a long time was if credit scores affected who get credit, and then thereby determines what people's credit score looks like. Now you have a feedback loop. And those things need to be analyzed completely differently because now we move to a game theoretic situation.
Okay. That was good. Thank you for the answer. And there are a couple of many more interesting questions. It would be really nice if you could go to the Circle Social where the discussion can continue.
Perfect. Thank you. Thanks, everyone. And bye-bye. And I look forward to Ready It's Talk. See you all.
Thank you.